Hi guys, Dr. Alex here. So we all know that the current COVID pandemic has really forced us to reevaluate basically every aspect of our lives. And dentistry is really no different. If anything, it's been kind of a hot topic lately because the very nature of the procedures that we do put us all, you the patient and us the team, at a fairly high risk of transmission. So it really requires a much higher standard of safety measures and protocols in the dental office to lower that risk and keep everyone safe. We ourselves may not be in high risk categories for COVID, but we all have people that are very close to us that may be. So it's our shared responsibility to keep all of those folks happy and healthy. And it's a responsibility that I take personally very seriously. I've spent the last 2 months while we've been seeing emergency patients really doing a deep dive into the science of transmission. That has led us to develop certain safety protocols here in the office that I want to run you through today so that you feel safe and comfortable coming in for your dental visits. So let's take a look. So one of the things that we've implemented is a daily screening of our team. Now, the very first thing that we'll do when we come in the morning after sanitizing our hands is to take a quick temperature using our touchless thermometers. We all have specialized PPE, or personal protective equipment. And the entire team gets tested for COVID on a weekly basis.
The first thing you'll notice is the implementation of our virtual waiting room. And what we're asking patients to do is when you arrive for your appointment, give us a call, let us know you're here. At that point, we'll ask you the same 3 screening questions that we asked when we scheduled the appointment. Have you had any cold-like symptoms over the last 14 days? Has anyone around you had any symptoms? Or have you experienced any loss of taste or smell? We'll also ask you to place your mask before entering the office. And once you do, you'll be greeted by one of our team members, and you'll make your first pit stop at the sanitation station. We'll give you a healthy dose of hand sanitizer, a mask if you don't have one, and also ask you to place all of your personal belongings in a bag to keep them clean while you're in the treatment rooms and prevent cross-contamination by touching items that can be difficult to keep clean.
So every detail matters when it comes to keeping us all safe. Now, that's why we've taken a very close, hard look at our treatment rooms to make changes to make them safer for all of us. And it really starts with the fact that they are private treatment rooms. Every room has a door that we close during procedures to prevent the spreading throughout the office of dental aerosols. We also have UV filtration systems installed in every treatment room that are constantly 24/7 here in the office, cycling the air in the treatment rooms, fully sanitizing it. They're commonly called air scrubbers, and you may have heard of them. Now, another change that we've made is the engineering of all of our cabinetry. We've made sure that everything has sealed faces in all the drawers to prevent aerosols from getting into drawers, into nooks and crannies that would be difficult to fully sanitize. New scientific data shows that iodine rinses are the best and most effective way to kill envelope viruses such as COVID-19 in the mouth. So the aerosols that are produced are far less risky. So a very important aspect of making sure that dental treatment is safe during the pandemic or at any point is really very strict protocols when it comes to instrument sterilization. We have state-of-the-art equipment to help us ensure that every time we use an instrument, it is fully heat and pressure sterilized in between patients. So one of the biggest questions that dentistry has had to answer during this COVID crisis is how do we prepare a treatment room for the next patient? Most of our procedures create aerosols, and that mist can contain some harmful virus or bacteria in it. So how do we get into all the little nooks and crannies to make sure that everything is clean before we bring the next patient back? Now, I've done a lot of research on this topic, something that I feel very passionate about, And what science has shown me is that the use of hypochlorous acid is the most effective way to kill those bacteria and viruses. This is completely odorless, tasteless, and non-toxic to humans and the environment, but it is supremely toxic to pathogens or viruses, bacteria, including COVID-19. Now, the way we use this stuff is with this little contraption here. This is called an ultra low volume fogger, and it looks like a flamethrower, sounds like a vacuum cleaner, and what this does is it creates a mist or a cloud of this hypochlorous acid in the treatment. Now, we do this after every aerosolizing procedure so that all of the little nooks and crannies and all of the things that we have in the operatories get touched with that hypochlorous acid, and that way we know that they're safe for the next patient.
So when you're ready to get back on track with your preventative treatment or your dental care, just give us a call, shoot us an email. We're here for you.